like many young people across just the borough, my phone's been blown up with texts to get the vaccine from my GP. And right now I'm kind of thinking that I'm going to get the vaccine, but I'm reluctant to do so, if that makes sense. I'm cautious around it. What do you guys think?
I'm not too sure about the vaccine. I want to take it, but I feel like I'm fine without it. I haven't shown no symptoms of COVID. I feel myself, so is it too necessary? I don't know.
It's funny you mentioned the text as well, because like I was completely for the vaccine until I received the text message this week saying that I should take the vaccine, and it made me hesitate. Before then, I was just thinking like all these conspiracy theories. I'm not really it might not be considered conspiracy theory, but to me, I'm not for conspiracy theories, and I just do what I'm told basically. But the text made me hesitate.
I understand that. It feels like such a big decision, and when people are really pressing it down your throat, you start to think, like, why? I don't know. It kind of scatters you a bit.
For me, I feel like if a majority of the population take it, then, you know, we'll be all right. We'll be all right. So, you know.
And that's the thing as well. I feel like with the rest of the vaccines, obviously, like they were made kind of before our lifetime, so we weren't involved in like the discussions around it and stuff. So when it came our turn to do it, you just did it without asking questions. But now with this one, because it's such like a live thing, there's like events going on. Like you said, people lost their lives. Like I've lost family members to it. But even then, you still don't like. It still doesn't convince you to fully take the vaccine. Like yeah, still a bit on the fence, I guess.
For me, it's just like, I want to take it, but I don't. Like, I feel like it's good if I was to go out to like events or restaurants, and especially if they're going to put restrictions, because I've heard a lot of rumours about that. But at the same time, it's just like, I don't know. I don't know how it will affect me in the long term. I don't know, like, how did they come up with this so quickly? It just doesn't really add up to me.
Lots of questions, yeah.
Yeah.
So we actually have a doctor here, so we're asking all these questions. We have somebody to answer them, somebody who's actually in the know. So, Dr. Francis?
Hi, I don't know if I know everything, but I can certainly try and help answer a lot of the questions today. So, I'm Dr. Francis Bowyer, and I'm a GP. And I work within Camden, and I've got one practice in Kilburn and another new practice in Holborn. And I have been heavily involved with COVID from the beginning in terms of just dealing with patients in my practice who had COVID, you know, in March 2020. And then following that, I was actually the clinical lead for the Camden COVID response unit, which is where we saw COVID patients and assessed whether or not they were ill enough to go to hospital. And following that, I then got quite heavily involved with Public Health England and research around COVID in schools and COVID in young people. And I was working with the immunisation and vaccine department within Public Health England as well. And so I've been more recently doing loads of research around the vaccine as well. And as a GP, my practice is a vaccine hub. So we also vaccinate loads of patients as well. So I think that I have quite a broad spectrum of experience in this kind of 15 months, this crazy 15 months that we've had. And it's really interesting to hear what you've got to say. But this is the thing about the COVID vaccine, it's not a traditional one, it's actually very different. And I can explain that later, but yeah.
So yeah, we've got some voice notes from like young people in Camden, and like they're sharing some of their concerns, and we'll kind of use that to like guide some of our discussions. I'll play the first one.
Soraya, I'm 21 and I'm from Somerstown. I would like to know more about the side effects, because you hear online and through social media about different side effects such as blood clotting, heart problems, and for me as a young woman, what scares me the most is the issues surrounding fertility. Can I please have more information on this? Thank you.
So this kind of cuts to the core of why so many people are kind of, you know, they got 1 foot in, 1 foot out around this vaccine, because I feel like when I'm considering taking the vaccine, I'm really like weighing the pros and cons, seeing like what's the chance that I'll catch COVID and it just like wrecks my body, versus not taking the vaccine, versus taking the vaccine and it's potentially, I don't know, giving me a blood clot. It's scary. That's why I feel like it's a big decision. So yeah, does anybody else feel
Yeah, I think what she mentioned about fertility, that really scares me as well.
I think that's a really, really important and valid point. And we as doctors, these are completely brilliant questions. And I think they're really important questions that people ask, because it's really important if you're going to take a medication that you know what the side effects are. I suppose as a doctor, what I found really interesting is that, you know, I prescribe people medication that is probably higher risk than this COVID vaccine all the time, and they say nothing. So the contraceptive pill, for example, like the contraceptive pill has a risk of clots, probably more than the very, very rare blood clots that we're seeing with the vaccine, but we don't have that conversation. And it's just so interesting that, you know, that we're doing it now. And I really hope going forwards people will use the same scrutiny with all medication, because otherwise what's the point? But in terms of side effects of the vaccine, what I think is really important to understand with this vaccine is that like vaccines aren't new. We've been vaccinating in this country for hundreds and hundreds of years. And so, and the flu vaccine is a vaccine against a virus, a respiratory virus, which is what coronavirus is. It's a respiratory virus. So in terms of people thinking that this is like some really new thing, it's not. We've been doing flu vaccines for very many years, and we've been vaccinating for a long time. So I think that's the first thing to be really, really clear about. And the second thing in terms of side effects is that you had mentioned the smallpox vaccine, which was the first vaccine I think that we know about. And you're right, historically vaccines have had a very, very dilute version of the virus in it, and that does help us replicate it. This coronavirus vaccine is amazing, and that's not how it works. And that's actually one of the most impressive for me scientific things about this, is that we've come up with a vaccine where you don't have to have a dead version of it inside it.
Sorry to interrupt, but I actually thought there was a dead version. I heard a lot of things about.
It's confusing.
Yeah.
It's completely confusing.
Because these are some new, like you said, they're new vaccines. I'm like, I don't know what I learned in school.
But they're new and that they're produced new, but the science behind it has been going on for a really, really long time. And so this is not new, but it's a new coronavirus vaccine. Do you see what I mean? But the actual science behind it isn't new. And the way the vaccine works, and I think the best analogy I've heard about this is it's a bit like a Snapchat. So I'm not on Snapchat, sorry, too old. But apparently on Snapchat, you put something up and you see it and then it disappears and you can't find it again. That's what I've heard. Is that right?
Yeah, 24 hours.
Something like that.
24 hours.
Yeah.
Oh my God, even better, 24 hours. Okay, so the COVID vaccine basically it's like a code, okay? So it's a code that goes inside the body in a certain manner. So one of the vaccines, it goes in with a special protein. Another of the vaccines, it goes in with like a dummy thing that the code is in. The code enters your body, okay? And the code basically switches on your body to produce messenger RNA, okay? So that's like another kind of protein. And then that thing disappears within 24 to 48 hours. And so all that's left is your natural's body antibodies that the code generates. Do you see what I mean?
Yeah.
So there's nothing in that vaccine that actually stays in your body for more than 24 to 48 hours. Yeah, because the code is there, it's getting you working. The code, then everything just disintegrates like a Snapchat, and then the rest of it is your body's natural antibodies working to recognize the virus and to therefore, when you see it again, know that we've had this and we can fight against it. So in the same kind of frame or method in terms of side effects and fertility, I can't see, and we're not seeing, how there's any way possible that can therefore affect fertility.
Okay.
And in fact, there are loads of studies that show women, in fact, even the studies generally, women have gone on to get pregnant and have babies. You know, in the news there was a first woman that had got pregnant after the vaccine and had the baby, and the baby's fine. And we're vaccinating pregnant women. And if you look at countries like Israel, they've they're way ahead of us, but they've been vaccinating women who've then all got pregnant. And so we don't think it affects fertility. We don't think. We're very confident it doesn't. But also, we vaccinate pregnant women in this country all the time. They get the flu vaccine, they get the whooping cough vaccine. So again, this isn't anything new. And like, I've had 2 babies myself. I didn't question getting a flu or a whooping cough vaccine in pregnancy because it's actually I'm making antibodies that the baby gets and the baby's covered for it. And it's exactly the same, we think, with COVID vaccine, in that actually women that have had it, their babies get antibodies as well. So the science is actually very steady and stable. Even though it's a new vaccine, the science, I think, is the same. And I would hope that does reassure people in terms of fertility. Men are also very worried about fertility. Loads of men, when I come yeah.
When you said that,
No, I'm
I'm
just-
scared now.
But it's not just a female question, is my point. I think lots of guys, are understandably asking the same thing. And again, if you think about the whole Snapchat analogy, there's just nothing in there that stays to be able to kind of affect the body in that way.
I was gonna say, I found the contraceptive thing like very interesting, because like I remember when people start talking about the blood clots, it was like, oh my god, you get blood clots, and then someone said, oh but wait, the contraceptive pill, you're actually more likely to get blood clots from that. And like you said, that's something we never like spoke about before, but now that you can compare it to something else, you're like, oh, this is a thing. But I think like you went into how it affects like when it goes inside your body, but for me it's like before it even goes into your body, like why does it have to be like an injection? Like I've got like a phobia of injections, and I don't know if that's what's stopping me or if it's everything around it, but like I don't like injections.
I mean, I think that's a really, really good question. And I think the answer to that is that all vaccines are that way. The only vaccine that isn't is the rotavirus vaccine, which we give to babies in a liquid form. And that we're able to do because it's a gastro thing. Do you see what I mean? So actually having it and it lining your gastric system is actually beneficial. But vaccines need to enter the body's fat tissues muscle tissue. In terms of being scared about having the vaccines, I think my answer to that would be that, this is why people like me are at vaccine centres, because we're really experienced and, we vaccinate people who are scared, we vaccinate people with learning difficulties, people, we see this all the time, in terms of just normal vaccines, we vaccinate babies, and preschoolers. So this is something that isn't new to us and we do it all the time. So my answer to that would be just, don't feel that that's the reason to stop you, and just tell someone when you get there, look, I'm really anxious about needles, and they will look after you.
On the topic of the blood clots, if there's no concern around it, if the concern should be like minimal, then how come we saw in like the EU people that the countries just stopped their rollout of certain vaccines? I think it was AstraZeneca, because of that heightened risk. So should we be concerned that our government potentially, or the NHS, whoever it is, isn't following international guidelines on the rollout?
That's a really good question, and the answer to that is it's about ratios. The clot, actually, I think it's really interesting that people are using the word clot, because it's not just a normal clot. It's a clot that's associated with like a genetic predisposition for your blood to work in a certain way. So like it's just literally between 3 to 5 in 1 million chance. So you probably have more chance of winning the lottery, I would say.
Fingers crossed.
So yeah, exactly. So from that point of view, I think just perspective is really, really important, because the people that are doing, and of course it's happening, but it's not just a clot. It's actually a clot in the context of a blood clotting problem. Do you see what I mean? But to add to that, when we were rolling out the vaccines at the beginning, the risk of getting COVID and dying was super, super high. And then, of course, we had lockdown and the risk of getting COVID was nothing. So then you think, well, actually, what's the risk benefit? And it's interesting now that the rates are going back up again. There's talk of saying, let's bring AstraZeneca back again now, because the risk is actually getting higher again. So that risk is not static. It's always changing. And that's why I can understand how people are confused. You're saying, well, it's bad, now it's good, and now it's bad again. But actually, it's just all about the risk-benefit ratio, depending on the rate of infection at the time.
Okay.
Would you say the risk-benefit ratio is quite responsive to the different strains that are coming up?
I think that's the other thing that's a really, really good question, because when we talk about vaccines, like why are we having the vaccine? What is the point? And what people forget is that the vaccine is to prevent death and serious illness from COVID, okay? So that's the percentages of 90 plus that we're seeing is against death and serious illness. So no vaccine is 100%. But what would you rather? Get COVID and go to hospital, or get COVID and just like have a runny nose or a sniffle?
Sniffle it is.
Exactly. Yeah, I think that's quite intuitive.
Do you see what I mean?
Yeah.
And so in terms of that, I think that's really the most kind of important thing just to be mindful of. So when you're talking about variants, one variant might give you a runny nose and sniffle, one variant you may not notice it, but the whole point is you're not dying from it and you're not going to hospital and getting seriously sick from it. And we haven't even touched about long COVID yet, right? Because actually long COVID is something that is more likely to affect your generation, because the older people are either dying or, getting really sick. And long COVID is something that you definitely don't want because we don't really know much about it. It can last. Long COVID. Long COVID is people who have COVID but just aren't right. They just can't go for runs anymore. They sleep all the time, and when they had COVID, they barely knew they had it. But I'm seeing a lot of kind of young people who are normally really fit and well, but just exhausted. And it's a bit like a post-viral fatigue syndrome. And because it's so new, we don't know much about it. It's really difficult. But I would argue that I think people are always just thinking about, hospitals and death, but actually, you just all heard about how busy my day was today. Like if I had long COVID, I would not be able to look after my children. And do you see what I mean? And I think you just need to think about, stuff like that as well.
But on the topic of variants as well, like I heard that there will always be like a new variant that comes out that there's no way to stop it. So does that, like, in terms of the vaccine, does that mean we're always going to have to take like top up vaccines to like deal with the new variants?
Yeah, that's a really, really good question. I think with the variants, it's not so much of a big deal, but what we don't have an understanding of is how long immunity lasts. So even pre-vaccine levels, even pre the vaccination, we were seeing that people who had antibodies, it was waning after about 6 months. We're still learning, and certainly with the vaccine, that's one of the reasons why we have two. And we have a booster, and a lot of the immune schedules in the UK, we have more than one. And you had mentioned before, it's a new vaccine, we haven't had vaccine all the time, but actually, the HPV vaccine is something that I think's happened in your generation, the one for papillary for girls, and now boys are having it. Cervical cancer, exactly. Yeah. That's quite a new one. But yeah, the word is out and the research is out on that. So we'll know more later about if we need boosters or not. But again, if we think about this being a flu-type virus, and we do flu vaccines every year, and I don't know, you guys are too probably young to have flu vaccines, but flu vaccines are every year, and what they do is they monitor the flu strains and variants in the year, and then they switch the vaccine a little bit so it targets different likely variants and strains every year for the flu. And so, yeah, it may well be that, in a few years' time, or I don't know, but that we do have a different type of vaccine to combat it.
Dr. Francis, sorry.
Francis is fine.
Okay. So I think, if I recall correctly, early in the year, around January, when there were concerns about supply of the vaccine, there was some talk about mixing and matching the AstraZeneca and Pfizer vaccines for your second dose. What is happening there?
Yeah,
should we be concerned? Because I heard that and I was just thinking the
guidance at the moment is that there is no mandate to mix and match. You have the first vaccine and the second vaccine are the same unless you have a very serious side effect to the first vaccine, of which I have seen none, I have to say. And I've been kind of supervising many clinics and probably, tens of thousands. So unless there's a severe allergy, we do not mix and match. We just don't have the data out there to prove it. And that actually just stresses how we are being driven by data here more than anything else.
So where did that story come from?
I think, I don't know. I mean, we have seen some mix and matching because it's a mistake maybe, but it's not very common to do that. I think the other thing to say is that it's all very, very new and early days. So some people might have thought they had a severe side effect, but actually they didn't, and they could have had it, and but normally the first is the same as the second.
Okay, I see.
What about people with specific medical history?
Yeah, so I think this is really interesting. We've had lots of people come to vaccinate, and they say, I've got these terrible illnesses, and actually you're the people exactly that need the vaccine. So in terms of medical, there's no contraindication to the vaccine other than being allergic to something within the vaccine. But if you remember what I said in that, it just has in it basically a code with a bit of protein and some, it's actually halal, it's kosher. There's no.
I heard the rumor that there's pig inside.
There's no pig.
And actually,
the Society of Imams have released a statement, and equally the Jewish Council. There's nothing in that vaccine that it goes against any religious anything. So from that point of view, to have a true allergic reaction to it is almost unheard of. And in terms of like the most common side effect is a sore arm, and I think the sore arm is noticeable. 24 hours. Some people get a headache. 24 hours, a bit of tiredness and lethargy, and that, I say to people, that's really reassuring. It shows you that you're making those antibodies and it's working, and I think, if people are ready for it, then they don't get worried and anxious by it. But side effects go as quickly as they come, and it would be unusual, I would say, to have anything for more than 72 hours.
I've heard that you can get like heart issues or like cardiac issues and things like that.
Yeah, I mean, I think that there's some data about maybe young people, but when I say young, I mean under 18. So they're now doing some trials in younger people, under like 12 to 18-year-olds in America, and there is some evidence about a rare side effect. And rare is, is in a couple of hundred, because they're vaccinating thousands, hundreds of thousands even. And so that is kind of inflammation of the heart, but it's very unusual, and they think it might be something around the fact that you're giving a younger person the same dose as an adult, and so there might be some dosing stuff there. But from that point of view, we've not seen it really much in this country, because we're not vaccinating under 18s here.
So that's just for kids then. So I don't have to worry. My mom doesn't have to worry.
I've not seen anybody come back with those side effects. No.
Okay.
So you said you've not seen anyone with any side effects. Like, have you not seen anyone whatsoever with any side effects?
I've had patients call me up a week later and say, I've got a headache and I'm really worried. And then, the guidance is, if you've got a headache, then we can check your bloods to see if you've got this clotting problem. And I haven't had one that's come back with the abnormal bloods and the headache left.
I've heard even people can become blind from it. So like
blind?
Yeah, blind.
You think that's bad? Have you heard about the magnetic thing, where if you take a vaccine, you can get like a piece of metal or something, and it would just stick to your arm?
I think
my
that was,
uncle sent that on WhatsApp.
Yeah, I think that was a video of some like US politician putting a key on her arm, and she was trying to get it to stick, and it was all very embarrassing. But if that can be spoken about in the Congress, I'm sure there's some sort of. What do you think about that?
Yeah, I mean, that's just wow.
Her face says it.
Not sure about that one.
I think I've never heard of anything about that. There's nothing in that vaccine that is purely metallic. There's no, and this is the other thing, people saying it's DNA, and I was really specific about saying there is no DNA in the vaccine. It's messenger RNA, because messenger RNA is the code that helps produce the antibodies. So there's nothing in that vaccine that can change your DNA, because there's no DNA in it. It's a code that helps messenger RNA produce the antibodies, and certainly there's nothing metallic in the vaccine at all. And I'm amazed by the stories of magnetic, but I thought at the end it was maybe like someone's sweat or something, or it's looking.
Yeah, that's
yeah. But yeah, I think this goes back to just making sure your sources are reliable, because
What's that, Barney's?
yeah, exactly.
And like, as much as I wish like social media companies did it for other stuff as well, like they have been quite like responsive to like COVID. So like if you post a picture that has COVID in it, Instagram will straight away put like a thing. Like WhatsApp, they introduced that thing where if someone's forwarding so many messages, it says forwarded many times.
Yeah.
Like when my uncle actually posted the magnet video, said on top of it forwarded many times. Yeah, it's crazy.
Yeah.
For me, it's
What's
like,
up?
I believe what you're saying, because you're a doctor, but it's just like, how do I actually know what's, like, I don't feel like we've been kind of given enough information about what's actually in it. Like, we've just been told. I know we don't get, like, kind of told about everything, but for something that's just arisen recently, it's a bit like, shouldn't we be given more information and knowledge about it?
Yeah, no, I think that's a really, really valid point. And I think as a healthcare professional who speaks to, many people every day, what's been very clear to us is that the communications around lots of things hasn't been so straightforward. And I haven't seen much comms about the vaccine that's like in the mainstream. Mm-hmm. But if you actually were to kind of do some research, Public Health England have some incredible resources where you can have videos and leaflets where they do really break it down. And so it's there, but you're right, it's not like really out there.
Yeah, that just makes me think, like, why aren't we seeing posters and
Why is it so
adverts
hidden?
when they're not just like literally explaining how mRNA.
Yeah, well, I think that's
It's
the
just telling
difficulty.
you get the vaccine. That's
Yeah.
not helpful.
You're right, but I think that if you think that the kind of what Public Health England have to do with a lot of these things is kind of I think they say it has to be eligible, or an 11-year-old child basically needs to be able to read it, and so it's really difficult to explain. I think the main message is for people to get the vaccine as opposed to what's in it. And again, we don't have that for MMR, we don't have that for flu, we don't have that for the HPV. So you've got to also just treat it a bit. Do you see what I mean?
Yeah, we also don't have those conspiracry theories for the other ones, so you have to kind of...
I feel like there should be like initiatives, like there's Eat Out to help out, get the vaccine, maybe travel, something like that. Like
Portugal.
exactly. I was going to get Afro-Nation, I can't now. So
That still raises a good point though. Like we trust you. Like you're a medical professional, and like I feel like medical professionals have always been ahead of the curve with it.
And I think this is the thing about the vaccines, and I don't know what you guys. I mean, you mentioned that you'd lots of family members, and that's I'm sorry to hear that, but I think that ultimately the thing about vaccination is that it only works if a certain amount of people do it. And we all heard about herd immunity right at the beginning of this, when they were like, yes, let everyone get it, we'll all get herd immunity, and then they were like, actually maybe not, because so many people are dying. But the point about herd immunity is that really you need between 70 and 90% of the population to be vaccinated. Otherwise, it doesn't work so well, unless you're thinking about your little micro bubbles within, your movements. But so in terms of vaccination, it's not just like, you can't really think about it. Herd immunity is just a scientific definition that means if enough people have got the antibodies, then when you get virus, it doesn't circulate as much because, lots of people just won't get it. So that's a scientific term that they had used at the beginning. And I think we didn't know much about it at that time, but I think now we do know more about it. But we're talking about herd immunity in the context of a vaccine as opposed to letting it do naturally. Do you see what I mean? And so in the context of a vaccine, I think maybe for young people like yourselves, you're right. You're probably not going to die from COVID, and you're probably not going to go to hospital from COVID. So yeah, why should I do it? And I think the answer to that would be in the same way that when my babies were vaccinated at 8 weeks old, I'm doing that so when they go to school and there's no MMR outbreak or measles outbreak. Do you see what I mean? It's not really about my child. It's just about the community and not having outbreaks. Do you see what I mean? And so I think for a young person, the difference is that, whereas my kids had no choice because I took them, you guys do have the choice, and you do have the ability. And, if we're going to talk about responsibility, perhaps, is that the right word, about, is it your responsibility for your community to, stop kind of that potential spread amongst yourselves?
So what are the long-term impact of the vaccines?
Yeah, I mean, that's a really, really good question. And if I'm going to be very honest with you, I think the answer is we don't know. But what we do know is that it's likely to be minimal or zero, because as I said before, we've done vaccinations for a long, long time, and there isn't any long-term implications for the flu vaccine, for example. And in fact, the fact that we have to have boosters every year, I think, says to you as well that these antibodies, we don't even know how long they're going to last. So in terms of long-term side effects or implications, I think that in truth, that's yet to be seen, but actually scientifically, it's very, very unlikely to be anything significant. And I would feel quite confident to say that.
In terms of like face masks and restrictions and things like that, if majority of the population did take the vaccine, then how could we kind of go back to normality and kind of...
Yeah, that's a really good question. And I think the answer to that is it depends on where you live. So if you look at America, for example, they have introduced laws from the CDC saying that if you've been vaccinated, you don't have to, you can go indoors, you can do this, you can travel within America without, having to quarantine, and you don't have to wear masks indoors if you've been vaccinated, whereas in this country we're a little bit more cautious. But I think time will tell there. I think the cautiousness is about just waiting for the data, but I think the data is increasing to look really good. And the reason I say that is because as a GP, my practice has got 30 6,500 patients. And all of the COVID... Yeah, big practice in Kilburn. And all of the COVID results, if anyone requests a COVID test, your GP will get the result as well as you. So we monitor all of our results that they come in. We get a lot because we're a big practice. But the only COVID I'm seeing now is people under 30. And that says a lot to me. And to me, that's saying like the vaccines are working, and that young people are mixing up, and they need the vaccine. So I mean, obviously, I'm not, I'm very biased. I appreciate that, but I think my bias is definitely based around science, and that it's really interesting that the people getting COVID now are young.
I'm just a bit confused because I think you previously said that if you are vaccinated, you'll catch COVID, but you won't be hospitalized.
No, you might not catch it as well. We don't know.
Okay.
So, but you're not going to die, and you're not going to go to hospital from it. Okay. Very unlikely. Or serious illness. But yeah, you could not know. What we don't know, and that's what we're finding out, is if you've been vaccinated, A, can you get it? Mm-hmm. And B, if you do get it, can you pass it on
that's
still?
That's what I was thinking. Like, what's the point of this whole thing if you can still pass it on?
But we're getting increasingly confident that the likelihood of that is low. Mm-hmm. But we don't know yet. But as I say, the fact that we're going, the infection rate's going up and it's not older people getting it, I think says a lot.
Mm-hmm. I mentioned that I've lost some family members to COVID, but like even when that happened, my whole family rushed to like that person's house, obviously because it's like a funeral and stuff. But like for me, I was thinking there was COVID in the house. How can you go to somewhere that has COVID in it? And like, even though we've lost family members, still, like, a lot of the community are still going about things how they would go about it. And obviously that's, I guess, is reflected in like the higher death rates within like BME communities, basically.
As a doctor, I like the stories and the things that I've seen around COVID are just quite amazing, if I'm honest. But I have definitely, without question of doubt, and we know this with the data, but even my anecdotal stories as a GP have seen that it is disproportionately affected, Black and Asian minority ethnic families and people, and we're figuring out more and more why that might be, and I think there's a lot in there about health inequalities, and like living in London, and it's just really interesting. I work in Kilburn, and we've done loads of audits, and at the beginning of the first wave, we had patients die from COVID in the practice, and they were mainly over kind of 70, 80. Camden has a very, very young population, by the way, so it does skew the numbers.
Average age is what, like 30 something?
Exactly that. So Camden's very young population. But second wave was just seeing lots of younger people die who were Black, Asian, ethnic minority, and I think that was because they had secondary diseases such as heart disease, diabetes, and chronic illnesses. And there's also an element of the fact that because of socioeconomically, they weren't living in houses with massive gardens, or they had to take a lift to their home, and lifts actually are like worst viral kind of incubators,
enclosed spaces,
absolutely, and like touching those buttons, and and like all of these things had really did affect, I think, and also Black and ethnic minority people are more likely to be the bus drivers and work in, in healthcare professionals. As I explained, I got COVID like first week. But, because we are facing people all the time, we're in those jobs where we can't work from home. Mm-hmm. And so therefore high risk. And I think that there is something to be said about, if young people are Black and or Asian or ethnic minority with family members who are higher risk often, there is something to be said about thinking about the vaccine for your people around you, specifically, and not just for yourself, because they do have different risks for COVID, and we're learning more and more what those are, but chronic disease is definitely one of them.
That definitely plays into my thinking about it, because I'm kind of like twisted in two ways. So I want to get the vaccine mainly because I know that, Black and Asian communities have been devastated by this pandemic. But I'm also aware that the very same reason, well, some of the reasons that we have been affected so much is because of the issue of medical racism in the NHS. The fact that you're more likely to get poorer care if you are Black or Asian within hospitals and such. And now it kind of feels like do we have to lean on the very same system that has been neglecting us? That's cool. Like essentially, like pushed up these death rates to then save us from this disease that is disproportionately impacting us. Does that make sense?
No, I hear what you're saying, but I think the response
we have a reason to trust.
Yeah, but I think the response to that is that ultimately medical professionals are like the like our kind of oath is to do no harm. So all of these I think is kind of indirect things that are happening, and there's so much research now going into it, and there's so much work to really truly understand where and how all of this is happening, and this is so important. But I do feel as a Black doctor in London that even I've got stories of medical racism with family members who've gone to A&E, and like had I not been a doctor and been like, what are you doing? Maybe things would have been different. Yeah. But I do feel that things are getting better. And actually, like let's just wind back a bit and think about how we don't get into that position. And that would be by protecting ourselves and our communities and getting the vaccine. And it's just devastating that like it's the Black people who are not getting vaccinated, and interestingly that the rates of it gets worse as we get younger. So we know that like Black under 40s, for example, are just not having the vaccine, and that is devastating because if we do hopefully not get another wave, who are the people who are most likely to suffer? Do you see what I mean? And then it's just this awful vicious cycle. So it's really difficult.
What do you think can be done to increase that trust? Because I think myself, lots of my family members and lots of my friends have had these experiences where their concerns are being overlooked by doctors, and that produces this deep stain, this deep level of like personal mistrust in the people who are supposed to be looking after you. And I don't think that's something that's so easily remedied. That I don't know if anybody else can chime in on that, but what do you think can be done to
I think this is where conversations are really important, because at the end of the day things only change with relationships and conversations, and I think that education is the first thing that needs to happen, and then you have the conversations, and then hopefully that leads into kind of action and things getting better. But I do feel that we're researching this more, we're educating ourselves as a profession about this a lot more, and it's not going to happen overnight. And I hope that one of the silver linings of COVID is, and I think I can see it already, but has been to highlight massively the health inequalities that race brings into illness and into health. And I really hope, and I can see already in Camden are kind of throwing a lot of funding behind increasing research, and I really, look out and see how.
And even like on the education of it, I feel like whenever I've had conversations with my friends, and like you might get to something like, okay, let's take the vaccine, then like something new comes out, and it's like, okay, no, it's like every time something new keeps coming out, and it ruins that trust, I guess.
Yeah. I mean, what I would say to that is that you need to look at the bigger picture in terms of something coming up every day. You will hear one story, but actually the bigger picture, if you look at probability, is that you're going to be okay.
What's the thing I heard about like us being used as like testers, and do you know what I mean? In Congo, like a lot of people were asked to take the vaccine first, and I'm not too sure how that happened.
Yeah, so I don't know about this Congo story particularly, but there was some concerns about the countries in which the vaccine was tested.
There's the two French doctors, I think.
They said that we should test it in Africa.
Exactly.
That's mad.
Yeah, I mean, I think that's obviously just blatant racism. But in terms of the trials in which the study was done, when you come up with a vaccine, you have to go through loads of different phase trials, yeah? So phase 1 is when you just try it out with a few people and you see what happens, because you just don't know. And then phase 2 is when you try it out with like more people. In fact, phase 1, I think, is animal studies even. And then phase 2 is like a few people. Phase 3 is like more people. And phase 4 is like real life. Just get it out there and see what happens, yeah? Now, each of these phases traditionally take like 2 years each, because you need money Like trials cost millions of pounds. You need also people to do it, and to have people to do it isn't easy, because like how many people can say, yeah, just give me something that no one's ever had before and let me see what happens.
If you pay me the right amount, I might sign up.
Exactly. And so they just take a long time, and actually getting funding for trials is so hard. So, you know, I've got professor friends who you can wait 6 years to get money to like trials a really like potentially amazing medicinal product, but you just need money. And so COVID happened, and there's no money, there's like no limits. Like literally do what you want. You've got literally all the money in the world. So that's great. That money bit has gone. No, the money isn't an issue. And then you've got people who were going to take it. Again, we flooded. People were up for it because it's killing all of these people in the world. So like basically the two biggest barriers to getting something through are just not there. And it reduces from, 5-10 years, and you can do it in 18 months. But also what they did was they kind of straddled the phases because we wanted to push it through quickly. But we didn't do anything less urgently. We had to still use the same scrutiny to get it through. And also the bit where you just give it to everybody, you would only work where there's COVID, right? And so if you think about where there was COVID, summer last year, it wasn't in the UK. Remember, that's when we had our quiet lull. It was in Brazil. It was in South Africa. It was in places like, most African countries, because our waves were a different time. So that explains why those countries, and America actually as well. So loads of the studies were in America. But we could only do the vaccine trials where there's loads of COVID, right? And so that explains why certain countries were out. And in the UK, we just had no COVID in the summer at the time. And I think that's actually probably more what happened than conspiracy
We've
theory.
actually kind of gone into like the next part of the conversation, because I actually got a voice note from a young person from Camden. I'm just going to play that.
Hi, I'm Mo. I'm 19 from Chalk Farm, and I just wanted to talk about how quickly the vaccine was developed, because it's something that made me slightly unsure. How do they expect us to trust this vaccine when it was developed far quicker than any normal vaccine process? And will it even be effective against other strains?
Yeah. So, I think I explained why it was really quick. And the Medicines Regulation Agency in the UK is like super hardcore, and they would not, like, they're very, very particular, and they wouldn't let anything through without proper due diligence. And we're still monitoring it now, right? So we started in December officially at the end, and now we're in, June. And so it's still being monitored. There hasn't been any huge issues. Obviously, there has been some with regards to the issues with the clots, and that's been a risk-benefit ratio. And so that's being monitored, and they're monitoring it as necessary. In terms of being concerned about it going quickly and issues, as I say, it's being monitored. And the strains question on that call, I think the most important thing to say is that the difference between the strains is that it may work just slightly less effectively, but ultimately it will stop death and it will stop hospital serious illnesses and admission. And actually, I think that's the main things that we need to be focusing on.
Yeah, I find that interesting, because I actually heard like they've been researching COVID for like over 10 years as well. If that's right, I'm not sure.
Coronavirus? Yes. So, it was just so funny. I'm just going to tell an anecdote now. But as a doctor, I get all these letters, hospital letters that I have to read. And coronavirus is... But anyway, I had a patient who had a letter. It was a young man, and he'd gone into hospital. I was just going through something else, and I think it was dated like 2018 or 2017. Anyway, he had coronavirus, obviously not this one, but another coronavirus that basically caused him to be quite ill, and he went into hospital with, complications. But like coronaviruses aren't new, they're there. But, we were all like, because we just not heard of it before. Do you see what I mean? And I think
apparently
that's...
the common cold is
it's exactly, yes, absolutely. And
There's even like a Simpsons episodes where they talk about coronavirus.
exactly.
Yeah.
Everything. That's hilarious. But yeah, it's not new at all. And as I say, it's a respiratory virus. Because another thing that people are always like, I'm not taking the vaccine. You don't have a vaccine for HIV, and you don't have a vaccine for this. And so, well, HIV isn't a respiratory virus. It's actually a blood virus. It's like a lot more complex. But this is a respiratory virus. This, on the same level as a flu. Do you see what I mean? And we've been doing this for a long time. And we've got those. It's not completely new. So I think that it's just about understanding kind of on a basic level of what it is, and therefore why we've been able to do it. Because if it's akin to flu, we've got flu vaccines and we're giving them every year, and we have been for many years.
I probably will take it. I don't know. I'll see. But I do think everyone should take it. Like a lot of people, a lot of young...
I think people should take it if you want to take it.
Not me.
No, I do think there are a lot of things that you've answered and a lot of concerns that may not have been addressed. Yeah, I think that's kind of put my mind at ease, and I probably will take it. I might wait a bit longer so that we're fully confident. But yeah, I do think I'll take it.
I think I'll take the vaccine, but I think it's just an issue that I trust the medical community and doctors such as yourself. But I guess you just kind of have to cut through that and talk to people who are in the know, such as yourself. So yeah, I'm down for the vaccine.
Yeah, I think it's really important to stress that obviously it's not mandatory, and we don't have that system in the UK. Like, no vaccine is mandatory, and so it has to be your decision. But I think the whole point is it's got to be an informed decision.
Mm-hmm. Yeah.
And so if you're not taking it because of something that isn't truthful or not correct, and that is not informed, and that's, I think, the most important thing that you need to speak to your peers about, is that if they're not taking it, is the reason actually a correct one, or are they getting their information?
Yeah, I think that really is important.
Yeah. But like I said, my biggest concern was like the phobia of injections. Like when I was younger, I actually went to get injection once, and the doctor told me about like a cold spray thing that I didn't even know existed, and like they spray it on top of your arm, and like you don't even feel anything.
Yeah.
Like you've answered a lot of questions that I had. I'll probably end up taking the vaccine if I'm completely honest.
So if you want to find out more information about taking the vaccine, then click the link right below and just educate yourself and be healthy.
Make sure to look out for episode 2, where we'll be discussing like how to get trustworthy information, like Dr. Francis mentioned.